Thank you for joining us today. This is the kickoff of our second half of our programming for intimate partner violence. The second half of our series, we will be doing monthly symposiums. So today we're going to be focusing on culture change, and we're really excited about the speakers that we have and our ability to get everyone together today. We had 5 primary goals for our grant. What we're doing for the second half is going a little bit deeper into 3 of the main goals that we had in order to really answer questions and dig in to things that we can do to work on primary prevention. So this month, we have been working on understanding social factors attributed to the prevention of intimate partner child violence. And we're looking at cultural change primarily today. We have no disclosures that have come up. So today we've got 3 speakers. Our first is Allison Jones Lockwood, and she is the head of Start by Believing. Marty Liccardo is starting. And then we have Dr. Catherine Fay, who does some research on changing the culture of primary prevention of intimate partner violence within the healthcare system. Allison is a training and technical assistance specialist for End Violence Against Women International. She's nationally recognized for her expertise in designing community-specific collaborative protocols to address sexual violence. With 20 years experiencing managing and assisting victim advocacy programs, Ms. Jones Lockwood has trained extensively on the criminal justice response to sexual assault, including the impact of sexual assault in the aftermath. She has trained countless advocates, law enforcement personnel, healthcare professionals in local, regional, statewide, and national trainings. She eloquently describes the role of the advocate within the criminal justice process, clearly explaining the benefits of victim advocates and how criminal justice professionals and advocates can work best together. Ms. Jones Lockwood offers strategies for collaboration and conflict resolution within the professional relationship.
Thank you. Thank you for the introduction. My name is Allison, and I'm Start by Believing Community Liaison and Training and Technical Assistance Specialist for End Violence Against Women International. I have worked in the field of sexual assault advocacy for 20 years. Most of my career was spent at a rape crisis center in San Diego with the United States Navy and also in the Kansas City, Missouri area. I've been with IVAWI for the last 10 years, doing a number of different roles, largely involved with training, social media, and the Start by Believing campaign. And today I'm going to talk to you specifically about the Start by Believing campaign, and we're going to look at it through the lens of primary prevention. So I'm going to talk about Start by Believing, but we're also going to talk about how Start by Believing can be used as a tool for prevention. But I want to start with a little bit of an introduction to IVAWI. As I said, we are a professional training organization seeking to improve the criminal justice response to sexual assault, domestic violence, and other forms of gender-based violence. We offer an annual conference, an online training institute. We have training bulletins, webinars. We have an extensive website with vast resources and best practices. You name it, we probably have a resource available on our website somewhere. We were started by a sergeant from San Diego Police Department who saw a real lack of training for law enforcement in terms of sexual assault response and investigation. And we were formed 18 years ago now, and we're getting ready to celebrate the 10th anniversary of Start by Believing. Start by Believing is a public awareness campaign really designed to change the way that we respond to sexual assault. Rather than responding with doubt, blame, or shame, it seeks to flip that response to support and empathy. And I already see a question in the chat. Do we work with police to help human trafficking survivors? We do provide some training resources for human trafficking. Most of those resources are available during our yearly conference. We do offer training sessions on trafficking during that. But in terms of actually having protocols and responses on how to interview victims of human trafficking, not specifically, but the resources that we do have available can be modified to work with human trafficking survivors, if that makes sense. To get us started, I want to talk a little bit more about, I want to start with talking about disclosures of sexual assault, what a helpful response looks like, what a hurtful response looks like, and then go from there. we know that most victims, when they initially disclose sexual assault or domestic violence, they go to a friend or a family member before they make a formal report or before they seek medical attention. And we're going to discuss this kind of throughout, but that response from that friend and family member is often the most critical response that the survivor will receive. Because let's say a 16-year-old child tells their mom that they've been sexually assaulted while they were at a party. And if mom responds with, well, what did you think would happen if you were out drinking? That 16-year-old probably isn't going to tell anyone else. They're probably not going to make a report. They're just going to attempt to move on their own. So we really need to make sure that friends and family members have a supportive response. And you can see these statistics here. I don't need to read them exclusively to you, but less than 20% of survivors report to law enforcement, and less than 40% of survivors will seek medical care. So in order to get survivors to the place where they feel like they can access medical care or that police report, we need to make sure that they have a supportive first response. We also know that when a survivor reaches out to one professional support, they are more likely to reach out to others. For example, let's say a survivor presents in an emergency department for injuries related to domestic violence or for a forensic exam after a sexual assault. That one contact, if positive, can increase the likelihood that they will file a police report. It also increases the likelihood that they will connect with an advocate or call a crisis line for support. So as you can see, that first response increases the likelihood that they will engage with others. And that's ultimately what we want. We want them to come to us for help and support. We also know that on average, survivors reach out to 2 to 3 different people before domestic violence. This is likely even much higher. Now, again, we go back to that scenario with a 16-year-old who reached out to their mom for support. Their mom was not supportive. They might not ever tell anybody else, or they may tell somebody 5 years later when they realize they can't really cope with what happened to them when they were 16. And that would be their second reach out for formal support. There are some survivors that persevere. The first person doesn't support them, they tell someone else. That person doesn't believe them, so they tell a third person, and maybe that third person then believes them. And I've done quite a bit of training on this in the community, and I've certainly talked to my own children about this. Encouraging survivors to tell and keep telling until they have that supportive response is so important. I used to do training for the PTA at my old children's school, and was training the teachers on how to respond if they suspect a child has been sexually abused or is being physically abused. And just keeping that pattern of keep telling until somebody listens, keep telling until somebody hears you. Now, I want to talk a little bit about what happens when the reaction to their disclosure is negative. We know that the negative reaction reduces the likelihood that they will tell anyone else, as I mentioned, and it also increases the likelihood that they have more harmful health and healing outcomes. Increases in post-traumatic stress, increases in suicide ideation, increases in alcohol abuse, drug abuse, any form of substance abuse. We know that having that harmful reaction really sets them up for failure in terms of their healing. And we know that they're less likely to tell others in the future. And I'm going to share a little story with you. Sam is a sexual assault survivor, and she's a forensic nurse. And we met in December. And during that interview, she told me that she didn't tell anyone when she experienced a sexual assault, because when she was the victim of an attempted sexual assault in high school, she was blamed for it, and she was told that it was her fault. And she actually watched all of her friends side with the perpetrator. So she knew that she was likely to get another negative reaction, and she was too afraid to tell anyone for fear of being blamed or for fear of not being believed. And she specifically said that she became a forensic nurse because she didn't want anybody else to experience what she had experienced. And I want to give a little bit more, but I used to be a volunteer coordinator many years ago, and one of the things that we would do with potential volunteers who wanted to be on the crisis line or provide hospital advocacy was we always required a volunteer interview. And many, many, many survivors would share that they had personal experience with sexual assault. And we really had to assess whether or not they were ready to volunteer based on how they had coped with a sexual assault. And frequently the ones that did not have a positive response to their disclosure really suffered for many, many years. And it was always one of the hardest parts of my job as volunteer coordinator to tell somebody, you know what, unfortunately, I just don't feel like you're ready to volunteer directly with survivors. There might be a little bit more work that you need to do before you're ready for this. And it was always such a challenging dynamic to see survivors 2, 3, sometimes 5, even 20 years down the road, still really struggling with this. I'm also going to share with you Elizabeth's story. Elizabeth is another survivor that I met with. We met in January, and she was sexually abused as a child by her father. She tried to tell as a child in a child's way that something had happened to her. And it wasn't until she was an adult that she told her mother that she was sexually abused by her father. And her mother's response was, I believe you believe something happened to you. So her mother did not fully acknowledge that she believed Elizabeth until many years after that. Her mother had attended kind of a self-help awareness presentation and returned to Elizabeth and said, I'm so sorry, I do believe you. When Elizabeth was a teenager and she told her parents she was sexually assaulted, she was told he didn't mean anything by it and it was an accident. And after those two experiences, by the time she was sexually assaulted when she was in the military, she told me she didn't bother to tell anyone because she knew that she wasn't meant to be believed. Elizabeth then attempted suicide 3 different times. The third time, waking up in a hospital room, she knew that she needed significant help. At that point, she reached out for counseling. She thought she had moved forward in her recovery. She thought she had healed from it. And then she experienced a number of triggers in 2017 and 2018 that kind of brought everything back for her. And she revisited counseling, and she actually started working as a volunteer for a rape crisis program, sharing her personal story. And her ability to share her story and find her voice has really allowed her to heal further, and embracing the knowledge that she truly experienced violence across the lifespan. And so when we look at that violence across the lifespan, if we go back to when she was a child, if she had been believed from the very beginning when she tried to reach out for help, or if she had been believed as a teenager, it's possible that the subsequent assaults might never have happened. So that's how we can look at this as primary prevention. It's also important to point out that it might be more beneficial to receive no support at all than to get a negative response. And this one, whenever I see this slide, it's always so compelling to me. No support at all. So being all on your own could be better than getting a negative response. Now we have Cindy's story. Cindy is a survivor of domestic and sexual violence. She was in an abusive relationship for her husband would torture her and act out sexual fantasies. And when she tried to reach out to a friend for support, the friend stopped speaking to her for her own fear. So that was breakdown number 1 in support. Then after 2 strangulations of Cindy and helped connect her with a pastor. And also, thankfully, the pastor was very knowledgeable in working with domestic violence survivors, and he connected her with a domestic violence program. Now, Cindy met with the advocates of the domestic violence program, and she wasn't really ready to identify as a survivor at that point, but she did stay separated from her husband. She walked away and she returned to the same sheriff's office several months later, and she met Investigator Frost. Investigator Frost, she's knowledgeable in Start by Believing, and she thoroughly investigated Cindy's case. And if we could go back to that very first time Cindy reached out to her friend, it's possible that we could have eliminated months of her experiencing violence. Chelsea actually reached out to us a few years ago on Facebook, And she reached out to us because she wanted us to know how Start by Believing had changed her life for the better. Chelsea was raped in 2012 as a college student. She went to the hospital for a rape kit, and the nurse told her that she didn't want report. When she did report to law enforcement did not believe her. They did not listen to her. Thankfully, her parents were supportive. Her closest friends were supportive, which did help Chelsea seek justice on her own. She testified before a grand jury, and it came back a true bill. Shortly after that, she got a call from Dwight Rudd, her prosecuting attorney. He had just been to a trauma-informed interviewing training called Trauma to Trial, and he had learned about Start by Believing during that training. And Chelsea, we met a few months ago, and I love listening to her tell the story. She was walking across the Brooklyn Bridge with friends when she got the call from Dwight, and she recognized the area code. So she's been very, very forthcoming about how she might not have ever made it to that wedding day if Dwight hadn't made that phone call. Chelsea was drinking heavily. She was engaging in other risky behaviors. She had actually been kicked out of school shortly after the sexual assault because she was very intoxicated on campus, and that was against the rules, so they kicked her out of school. So that one phone call allowed Chelsea to turn her life even smaller. The conviction rate is smaller, and then 0.02 to 2.8 end up in incarceration. So it's very, very, very low. But the criminal justice system is not the only way that survivors can heal. It is one route that some survivors definitely do want to pursue, but it is not the only way to heal. Also, I think it's very important to point out that the rate of false reporting in terms of sexual survivors come forward. So then we can see the prosecution rate, which is even smaller. The conviction rate is smaller, and then 0.02 to 2.8 end up in incarceration. So it's very, very, very low. But the criminal justice system is not the only way that survivors can heal. It is one route that some survivors definitely do want to pursue, but it is not the only way to heal. I also think it's very important to point out that the rate of false reporting in terms of sexual assault is very, very low. The studies coalesce around 2 to 8% are false reports, not coalesce, converge at around 2 to 8% are false reports. So again, it's very low. Most survivors are telling the truth. This doesn't mean survivors tell the truth on every single detail, but it does mean that they're most likely telling the truth. And that's part of why Start by Believing is so important. Rather than doubting survivor stories, it seeks to respond to every report as though it has merit. Start from that orientation that the survivor is telling the truth. So what are the key reactions for survivors? There are a few of them, and this is where we get into that primary prevention piece. Survivors need to be believed. They need to be told by their loved ones, their friends, their family members, that they believe them, that they hear them, that they see them, that they want to help them. So that feeling of being believed bolsters their ability to heal and participate if that's something they want to pursue. Survivors need to be validated for their experience. They also need to have someone to talk to when they want to talk to someone. And one other thing that I want to be really clear about is that survivors also need to be supported, not told what to do. So often when we have a survivor of sexual assault or domestic violence, as a responding professional, our response is, you need to report, you need to do this, you need to do that. And these are the steps from A to Z of all the things that you need to do. And we really need to take a step back and present that as, here are your options. Here are the things that you can do. If they present at an emergency department for a medical forensic exam after a sexual assault, simply explaining the process and then asking along the way if you have permission to proceed can be tremendously empowering to them. I remember clearly training advocates on how to talk with a survivor about whether or not the survivor wants to report, and being very mindful of never saying, you need to report this. It's so important. You don't want other survivors to come after you. We just need to be very careful with the language that we use so they don't feel that there's pressure after they've just had all of their power and control taken away from them. I want to talk a little bit about the primary evidence for the impact of the Start by Believing campaign. Now, I mentioned in my introduction that I worked for a rape crisis center in the Kansas City area. So this data, this impact is from that community, but it's after I left. I'm going to give you a little bit of background on what the community dynamics look like, but I'm going to start with the fact that Lamar Advertising, you've probably seen their name on billboards in your own community. They donated 17 billboards throughout the greater Kansas City metropolitan area. Kansas City is a unique community. It straddles two sides of Kansas and Missouri state line. And the metropolitan area is comprised of 7 different counties, ranging from urban, suburban to rural. It's a very diverse community. It's very different needs depending on where they live. Lamar also expanded into Branson, Missouri, and these billboards were displayed on and off over a year and a half. Now, a couple things I want to point out. MOXA, Metropolitan Organization to Counter Sexual Assault, is the rape crisis center that serves that greater Kansas City metropolitan area. I joined them in early 2000s. And we started at about 120 activations for sexual assault hospital advocacy per year when I was there. Now they are somewhere around 700 to 800, sometimes it's close to 900 per year. So overall, over the last 18 years, they've already seen a tremendous increase in hospital advocacy due to years of hospital outreach, connecting with SANE programs. And we'll talk about that a little bit more, but there was already a lot of things happening kind of in the background before these billboards went up in the area. The police department included 6 different patrol divisions in Kansas City, Missouri, and all of the patrol divisions had posters up in the lobbies. The Special Victims Unit had Start by Believing posters, and they also did some other forms of outreach. Now, here's where things get a little crazy. As you can see, the green arrow, the 79 at the top, is in approximately July of 2011. Now, I remember I said those billboards were up for approximately a year and a half, and I have the exact dates. I wrote them down. They were up from May 3rd to July 3rd, 2011. They were again up from November 21st, 2001 to January 15th, 2012. And then for a final run, June 1st through December 1st, 2012. So you can see things were trending up in May. They went from about 45 in April to 79 at the peak in July. That's 79 activations for a hospital advocate in 1 month. It was the highest level they'd seen in 5 years. And then it started to go down after the billboards went down. And then you can see in December, it ticks back up again to 49. So we can see the impact of the billboards on requests for hospital advocacy, but we also want to talk about what it looks like in terms of the increases in police reports, and then we'll get to medical forensic exams. You can see again in 2011, there was an increase in police reports in June. It hit a peak of 38 police reports. Now, I want to talk about the difference between the police reports and the advocacy activations. Remember that I said those billboards were put up metro-wide. These police reports are only for Kansas City, Missouri Police Department. So we don't see as big of an increase because it didn't include all of the other 57 jurisdictions throughout the metropolitan area. So likely this number would be significantly higher if we had that data, but unfortunately we just don't have it. We only have it from Kansas City Police Department. Now, again, medical forensic exams. You see the peak in June. trying to get to my grid here. So the higher peak for the forensic exams was in 2012, not in 2011. That came later. Now, a couple other things that happened that led to this. I kind of mentioned it previously when I talked about the increased outreach that had taken place. Can't get my slides to move, just a second. There we go. So there were multiple factors at play that also likely contributed to these increases. This was toward the end of the economic downturn, 2008 to 2012. We definitely saw increased sexual assaults. There was more cohabitation that resulted in more sexual assaults. And also in Kansas City, there was a new downtown party district that before I left in 2010, we were seeing pretty significant increases in cases where survivors were being drugged at this party district. They were getting in cabs, they were going home, and they were sexually assaulted in their home. So what started in Kansas City really spread metro-wide. So it didn't really matter as much where they live, because it just kind of happened everywhere, whether it was the cab driver that was sexually assaulting them, whether it was their partner once they got home, whether it was the friend that rode home in the cab with them. We definitely saw an increase in cases that all stemmed from this one local downtown district. There were new forensic nurse examiner programs added over the years. Remember when I said that when I started at Moxa, we had about 120 requests for hospital advocacy. Part of the reason that those numbers increased was because the SANE programs, quite frankly, became much more active. There's one program in the area called COVERSA, stands for Collection of Victim Evidence Regarding Sexual Assault. They started at one hospital. They were not in the emergency department. They were on the property, but adjacent to the emergency department. And they expanded their services to several outlying hospitals throughout the metro area. So more and more victims were getting exams, because the old scenario where they would present in an emergency department and they were told, we don't do exams here, you have to go somewhere else, that no longer happened. Of course, the Violence Against Women Act helped with that significantly as well, but having somebody on site that could provide the exam really helped. As I said, Moxa also did outreach with the hospitals. We did outreach with law enforcement just to make sure that they were aware of advocacy services. So that definitely is part of why the advocacy services increased so much. There were several high-profile cases and media interviews. I couldn't tell you how many times I was interviewed on the news between 2009 and 2010. And I actually remember coming home late at night to an empty house and being scared. My face was on the news all the time. And I remember being concerned that somebody would find out where I lived. And that was always very just kind of nerve-wracking, being on the news so much. There was increased public awareness and, of course, better ways to track and document cases. So this is Melanie Austin. She was with Moxa, and she said, we weren't ready for this. We didn't see it coming. They did hold, I guess I didn't mention that, they held an emergency summit to figure out how to respond to those activations, and policy changes were made on all levels as a result. So now I want to shift a little bit more specifically to Start by Believing. I have some campaign snapshots for you, and I have some videos, but first we're going to start with Nicole. I hope that you can hear her okay. She does speak kind of quietly, so I hope that you can hear her.
My name is Nicole Robb. I am 30 years old. I am a nurse. I am a Paralympic snowboarder. I am a daughter. I am a friend, and I am a domestic violence victim survivor. I use the word survivor because not only did I survive my attack, but I thrive today. The reason why I thrive today is because of programs like this, and because of family and friends who believed every word that I said.
A little background on Nicole. Nicole was in an abusive relationship, emotionally abusive relationship, for 6 years. When she tried to leave the relationship, her partner stalked her, and he tracked her down into a new apartment, and he shot her with a shotgun at close range 3 times. She nearly died. She was immediately taken to the hospital. She had multiple surgeries. She lost her hand, which is why she's now a Paralympic snowboarder. and the perpetrator died by suicide 3 days later. She has a website and it's called One Handed Nick, and it's pretty fantastic. So I want to spotlight some communities. There are a lot of active communities in Utah, Utah State University. We have Provo Police Department Victim Services here. We do have a lot of healthcare professionals that have participated in Start by Believing. Here are just a few images of some of those professionals. State of Arizona was the first state to become a Start by Believing state. There are currently 7 other states, so there's 8 states total. This is Denver, Colorado. Denver is a massive, massive campaign. It's a multidisciplinary campaign. So it involves the healthcare facilities, the advocacy organization, the mayor's office, the police department, the fire department, emergency medical services, other social service providers, and they are fortunate to have a very, very large marketing budget. This is one of their billboards that they put up a few years ago. And you can also see this bus sign in the middle. They've put cab toppers on cabs as well. And the picture on the left is their Special Victims Unit. Central Virginia is another campaign that had a large multidisciplinary impact. Several different law enforcement jurisdictions participated, including the Attorney General of Virginia. West Tennessee, I love to highlight this campaign. Those of you that are familiar with rape crisis centers understand that some of them cover one county, some of them cover several. Well, this one program in Western Tennessee covers 19 different counties, and they were able to secure commitments and proclamations from every single county, a policy leader and a police department within each of those counties. So it was very, very diverse. This is Utah State Representative Angela Ramiro. We are very grateful to her. She helped spearhead the first Start by Believing Day. We originally launched Start by Believing in 2011. So this is the 10th year of Start by Believing. We're very excited to celebrate the 10th anniversary. And in 2015, Representative Ramiro wanted to pass a resolution declaring the first Wednesday of April Start by Believing Day. And in 2016, we asked her permission to take it national. She was fully supportive of this. And now we are in our 6th Start by Believing Day. It is on April 7th this year, and we have a lot of exciting things planned. We're definitely in the preparation stage of it, so we're looking forward to that. In 2018, our conference was in Chicago, and Mayor Rahm Emanuel signed a proclamation declaring Chicago a Start by Believing city. And then shortly after that, Illinois became a Start by Believing state. Texas has been very active across the state in terms of their campaigns. San Antonio, Dallas, Austin, really, really broad campaigns across the state. Louisiana is also a Start by Believing state, spearheaded in that. I don't know why my slides keep skipping twice when I hit it once. I do apologize for that. But it was spearheaded by the mayor, Sharon Wester Broom, in Baton Rouge, and the Women's Advancement Commission. The advocacy organization there is called STAR. You can see that at the very bottom of their pledges. They were able to get every single state representative to take a selfie with a pledge placard. So we thought that was pretty cool. Iowa State has been very, very active in terms of their campaigns. I love that picture at the top left with their school mascot, and that's Ames Police Department and Iowa State together. They do presentations throughout the year. They actively use social media. One year, one of their officers dyed his hair teal in recognition of Sexual Assault Awareness Month. So that was pretty fun. This is a billboard in Arizona. And then, of course, law enforcement commits to Start by Believing. One of the things that I caution people that we work with, particularly advocacy organizations, is if you participate in this campaign and you promote it in your community, is law enforcement on board? What does that look like when a survivor then reports to law enforcement? Will they start by believing the survivor? So it's a question that communities really need to ask. And unfortunately, it can be a challenge. We have military embracing Start by Believing. And Oklahoma is also a Start by Believing state. Very, very good Native presence in Oklahoma that has really helped push the message. And then we have Mary Ann. You should be able to hear this one more clearly.
I always knew that something didn't feel right. And after 27 years, I realized that I had been sexually assaulted. And after 32 years, I spoke about it for the first time. I'm so fortunate that the people I chose to share my story with believed me. I was met with kindness and compassion. I'm so grateful.
Oh,
To
sorry.
the Start by Believing campaign and the End Violence Against Women International. We all deserve to be believed. I am a mother, a wife, and a forensic nurse. I'm also a survivor of sexual assault.
Mary Ann was pretty excited to do this video for us. We met in December. She wanted to connect with her family and make sure her family was supportive of her having her face and her name out there. And she was, you can just see the smile at the end. I love that part where she's just so happy to have an opportunity to share her story. One last thing, we have an event next week. It's 10 years and counting. This event is focused on a survivor panel. We'll hear from 3 different survivors who will share their story about what it meant to be believed or to not be believed. We also have a former sergeant with Metropolitan Police Department who's going to talk about what Start by Believing means to him. So if you are interested, you can reach out and let me know, and I can definitely send you the link for that. And I think we have maybe a couple minutes if there's any questions. I haven't seen a whole lot in the chat, so I didn't know if anybody wanted to unmute and ask a question.
Allison, there was a question about the just Utah's police departments. Do you know if any of them have been involved, specifically our campus police or any, like I said, any police departments in the state of Utah?
Good question. West Valley City Police Department has been involved. This was several years ago, and I know that they have a new chief since that initial launch. I don't know what it looks like now, but they have been supportive. Utah State University and Dixie State University, their campus police departments are very active in their campaign efforts.
Fantastic.
And Provo.
Okay. And I did forget to launch your poll, so I am going to launch it just so we can see how many people are or do know about Start by Believing. I know that I was not aware of it until we launched this program. So I know that Allison and I met after that when one of the nurses at the University of Utah who works with forensic nursing posted one of your videos that pretty much brought me to tears. And so, yeah, it's really good to know that, just find out these different campaigns and things that we can do to help. So that was huge for me.
That video, we're getting ready to release an updated version. It's coming out. People who go to the event next week will get first access to it, and then we will put it out to our email list. But it's way better. It's shorter, but the first one was really crazy compelling, but this one is even more so.
Okay. All right.
I wanted to say, Allison, it's amazing when you think of primary prevention, really this Start by Believing and somebody standing up and saying, I believe you at the very beginning is really, even though we think of it as being reactive when the event has already happened, but it also is preventing it from happening again. So I think, you certainly have shown through your evidence and all of your participation and studies that you've done that just listening and believing by somebody can really make a difference in people's lives. So it's been really interesting and helpful.
Oh, great. I'm glad.
And how do we get on your email list if we wanted to do that? Is it,
It's on our main website.
Just Start by Believing. Okay.
No, it's actually on the eVol website.
Oh, okay.
I would do that, but I don't know that I can figure out how to stop my screen share and not mess that all up. But it's on the eVol website. There's a spot where it's add me to the mailing list.
Okay.
You can see
So
all.
Allison, I do have a question for you. With the Lauren McCluskey Foundation and her family, etc., has that helped? I mean, I'm sure it's raised awareness because we all know about the University of Utah campus and the challenges that happened there. But I'm just wondering if her family involvement and their donation of funds, etc., has helped benefit this program, or how we who are associated with the University of Utah can capitalize on that program to help offer more support. Any thoughts about that?
That's a great question. Oddly enough, I just became acquainted with the foundation via social media about 2 or 3 weeks ago. I did not know that there was a foundation. And we did a little bit of tweeting back and forth at each other. And I know about their promise now. And I do think that that promise has the ability to make a lot of impact in the way that we respond. In terms of us actually working together, we haven't, other than just a few tweets back and forth. Somebody had also asked in the chat, I forgot, have we connected with the Elizabeth Smart Foundation? Again, not officially, a couple of Instagram things back and forth, that's about it, but we haven't specifically partnered with them. There's one other question. Do you think that sexual assault has been reported more because of the Start by Believing campaign? Have you looked at the data before and after Start by Believing was put into practice? You know, it's hard for us to measure that because, you know, where I sit, I have a national level view of Start by Believing. So I can't say nationally that reporting has gone up. Individual communities could say that, and certainly with the data from Kansas City, they can absolutely say that reporting did go up. San Luis Obispo and Arizona State University have made similar comments, but we haven't studied it, so we don't have the data to back it up other than anecdotal comments. But that's where the research comes in, and with wanting to do the research on that, that's grant funding that we don't have right now, so. Okay, well, I'm going to stop sharing my screen, and I want to say thank you so much for letting me be a part of your afternoon. I hope you all have a wonderful rest of your day and evening.
Thank you so much, Allison.
Thank
We
you.
appreciate you joining us.
Bye, everyone.
Bye-bye. Take care.